Nowadays, the equipment in knee replacements is so effective that younger and younger people with damaged knees really get tremendous benefit out of it. It allows them to get back to activities like playing basketball or tennis or golf, and it dramatically improves pain. You're a great candidate for an outpatient total knee. So we got you set up 2 weeks ago. So we're at 2 weeks and 1 day.
Correct.
From your knee surgery. We did your knee surgery. Why don't you talk about the experience?
My biggest fear was waking up with more pain than I had, or not being able to get around the house, not being able to function.
The amount of pain that you have is the biggest fear I usually hear from patients. They're really afraid of, this is going to be a painful procedure and being laid up for long periods of time.
I put on my ice machine right away, and then I got into my CPM machine. I didn't have any pain, but I also knew that the block was there.
Yeah.
And so just gently, just moving it back and forth to keep it loose. And then like I said, I started to feel pain around 9 o'clock at night.
So you had 7 out of 10 up to 10 out of 10 before surgery. What was this pain that you started experiencing at 9 o'clock at night? What level would you say that was?
A 2 or a 3.
You weren't even using the maximum level of pain medicine that we have available for
Correct.
patients because you felt like your knee replacement or your knee pain was manageable and that you didn't need anything else?
Correct. I mean, it was so much less than before surgery that once I got to the point where I could put weight on the leg without having pain, the rest of it was manageable.
Now we're 2 weeks and a day out. What's your pain level?
I'm maybe a 2. The pain that I expected to have wasn't there. I mean, that was my biggest deterrent to proceeding. Was I was just afraid that I would not be able to function. I wouldn't be able to get back to work.
So what would you just say to people that are considering knee replacement?
Don't wait until you're miserable to do it.
Brad, I really appreciate you taking the time to share your experience with us.
Yeah, this has been excellent. Thank you.
Awesome. You bet. We'll see you next time at Barbour Orthopaedics.